standing alongside missionary Dr. Kent Brantley. He called for them to be treated as heroes.
We've got hundreds of Americans from across the country. Nurses, doctors, public health workers, soldiers, engineers, mechanics, who are putting themselves on the front lines of this fight. When they come home, they deserve to be treated properly. They deserve to be treated like the heroes that they are.
So are healthcare workers, in fact, being treated unfairly? Are they being vilified? Joining me now from Rwanda is Dr. Adam Levine. He's an emergency response physician with the International Medical Corps, a humanitarian aid organization. He has worked in some Ebola hotspots. He's with us via Skype. Thank you for braving bad connections for us, sir. And also with us is Dr. Frank Esper. He's an infectious disease specialist from University Hospital's Case Medical Center. Dr. Levine, I'll start with you. You've worked in some of these places like Liberia in the past. In your medical opinion, should healthcare workers who have worked in those places be isolating themselves on return?
So healthcare workers who are healthy pose no risk to the American public. Essentially, this is a disease that's spread by contact with the body fluids of very sick people. You're not going to get it from bowling. You're not going to get it from passing someone on a bike ride. You're going to get it if you're caring for an individual who's very sick with Ebola. Americans who aren't doing that have nothing to fear, and they need to support the healthcare workers who are going abroad to do that, because if we don't have enough of them there, then we're never going to get this epidemic under control, and it could spread across Africa and across the world.
So these forced quarantines of non-symptomatic individuals, in your opinion, don't have a medical basis?
They do not have a medical basis. I think the CDC has put forward very reasonable guidelines, and what we really need is some clarity in the United States to make sure that across the country, all healthcare workers who are traveling abroad and returning get to follow the same regulations put forward by the CDC and the federal government. These regulations are common sense. They're going to protect not only the population at large, but also the healthcare workers who are returning. And I think that, as the public, we need to support these regulations and support our healthcare workers who are going abroad, because otherwise, if we continue to vilify them, to quarantine them, to put them into makeshift prisons, then what's going to happen is no one's going to be willing to go. And if nobody goes abroad to fight this epidemic, then it's going to spread outside of Liberia, Sierra Leone, and Guinea, across Africa, and across the world. The only way to stop this epidemic is to stop it at its source, by having more humanitarians going abroad.
Dr. Esper, that's an incredibly important point that Dr. Levine just made. Are you worried about the chilling effect that this kind of stigma could have on the broader fight against Ebola, which depends on these healthcare workers?
Yeah, I was honored to be invited to visit and view the president's speech yesterday. And let me tell you, the gist is very, very clear. We cannot defeat this germ and this epidemic by only playing defense. To continue that analogy, the best way we can prevent, and the best defense that we can have here in the United States to prevent this germ from coming to our shores, is a good offense in West Africa. And we need to encourage and we need to take the fight and keep the fight over there. Anything that we do to deter our people and our experts, as well as our resources, from going over there is only going to hurt us in the long term. And so any of these problems stigma standpoint, any of the problems from a quarantine standpoint, is just giving people second thoughts and may hinder them from going abroad where they are truly, truly needed. So we should really embrace those individuals who are coming back after fighting Ebola and containing that disease over there. And we shouldn't be worried about how they are taking care of themselves. They've been taking care of the sickest of the sick. They know also how to take care of themselves and those around them.
Dr. Esper, we've gotten reports of supposed discrimination, or at least unfair treatment of healthcare workers in Omaha, at Bellevue Hospital in New York. What do you do to address that?
The best thing we could do is really is education. The problem with the stigmatizing is not from that healthcare worker who is returning from Africa. It is for the people who are around that individual, the people who just do not understand the disease and how it's transmitted or how infectious it is. It is not infectious when people are well. It is not infectious when they have no symptoms and they're not having fevers. And even when they just begin to have symptoms, they're not very transmissible. The transmission of this germ happens when you are bedbound, when you are sick, and when you are in a hospital. And that's why what we're seeing for all the people that we've seen here with Ebola in this country, it's healthcare workers or returning missionaries or returning doctors who have been treating the sickest individuals.
Dr. Levine, there are new numbers out from the WHO showing fewer and fewer patients checking into clinics with Ebola symptoms. They say those numbers are real, they're measurable, they're not projecting that this is an end to the outbreak, but it's certainly a promising new fact. What do you make of those numbers based on your own experience very recently on the ground in Liberia?
Well, I think what this shows is that the humanitarian response is working and can work. I know I helped International Medical Corps set up its first Ebola treatment unit in Liberia in Bong County. At the time that we set it up in early September, Bong County had the third highest number of cases in all of Liberia. And now, actually, we have almost no cases occurring in Bong County. Simply because we set up an Ebola treatment unit, we found cases, we brought them into the unit, we isolated them, we treated them, and we broke the chain of transmission. And that can be done across Liberia and across West Africa if we can only just open up enough Ebola treatment units and staff them with enough humanitarians, as well as performing really excellent contact tracing in the communities.
All right, so some important signs of promise there. Early, but promising. Dr. Adam Levine and Dr. Frank Esper, much respect to both of you. And Dr. Adam Levine, glad you're out there doing this very, very important work. Much respect to your entire career and those of all the people who are in the same situation.